everyone, welcome back to Medico's Helpline. In this video, we'll deal with anatomy of pleura. We'll be dealing with the parts, surface markings, recesses, blood supply, and nerve supply. As you all know, pleura is a serous membrane lined by the flattened epithelium, which is also called as mesothelium. In this figure, we can see the green color covering of the lung is called as pleura. There are two layers of this covering. The principal function of pleura is to cover and protect the lungs. And the lining epithelium secretes a watery lubricant called as serous fluid. This serous fluid is secreted into this cavity, which is called as the pleural cavity. And this helps in lubricating the lungs for the smooth movements during respiration. Pleura consists of two layers, the visceral pleura, which covers the lungs, and the parietal pleura, which faces the chest wall. The moist space between the two layers of pleura is called as pleural cavity, and the pleural cavity contains serous fluid which helps in the lubrication of the lungs. The visceral pleura or the pulmonary pleura, we can see in the figure, is represented by this blue line. It completely covers the lungs except at the hilum and along the attachment of the pulmonary ligament, whereas the parietal pleura, which is represented by this green line, is more thicker than the visceral pleura and it lines the walls of the pulmonary cavity. Let us have a small difference between the parietal pleura and the visceral pleura. Let us start with the lining. Parietal pleura lines the thoracic wall and mediastinum, whereas visceral pleura, as the name suggests, is visceral, that is, it lines the surface of the lung. The developmental part, the parietal pleura, develops from the somatopleuric mesoderm, whereas visceral pleura develop from the splanchnopluric mesoderm. And now coming to the innervation, parietal pleura is innervated by the somatic nerves, so it is very sensitive to pain, whereas the visceral pleura is innervated by the autonomic nerves, and so that visceral pleura is insensitive to pain. Now, the blood supply and lymphatic drainage of parietal pleura is the same as that of the thoracic wall, but as the visceral pleura is concerned, the blood supply and lymphatic drainage is both is same as that of the lungs. Looking at this figure, we just get an idea about the various divisions of parietal pleura. Visceral pleura, as you can see, completely covers the lungs except at the point of attachment of the pulmonary ligament and hilum, whereas the parietal pleura faces various parts of the chest wall. Now, based on the position and based on the parts which the pleura faces, the parietal pleura is divided into four parts. First, the cervical pleura, the part of the pleura which faces the cervical region, the topmost portion is called as a cervical pleura. Now, coming to the second part, here the part of pleura that faces the costal cartilages, the ribs, as you can see here, is called as the costal pleura. Now, the third part is the mediastinal pleura. Here, as you can see, this part is the mediastinum where we have a heart. So this part of pleura which faces the mediastinum is called as the mediastinal pleura. Now coming to the lowermost portion of the pleura which faces the diaphragm and other parts, the lowermost part is called as the diaphragmatic pleura. The surface markings of the pleura gives us an understanding about the line of reflection of the pleura. For a better understanding, we have divided it into four parts. We'll see it one by one. The first part is cervical part. The second part is the anterior part or the front portion. Then we have the posterior portion or the back side. and we have the inferior portion. Okay, we'll start with the cervical pleura. The cervical pleura can be reflected by a curved line, as you can see on both sides. We get this curved line by joining two particular points. One point is on the clavicle, another point is the cervicoclavicular joint. We have a right and left cervicoclavicular joint. Now we'll see the right side first. The line joining the medial third and middle third, the junction between the medial third and middle third of the clavicle. We have a particular point. The line joining this point and the right cervicoclavicular joint gives us the cervical pleura on both sides. I think this is clear. Now we'll go to the anterior portion. The anterior line of pleural effusion on the right side. The line further descends down from the right the right cervicoclavicular joint to this particular point. This is the mid point of the sternal ankle. Then it further descends down to the siphisternal point, midpoint of the siphisternum. This is the right side. The left side, similarly, the line ascends from the left sternoclavicular joint, from the left cervicoclavicular joint to the midpoint of the sternum, and it descends till the C4 rib. From C4 rib, it in turn takes an arch to the C6 because we have got heart here and the mediastinum, so it in turn takes an arch. This is all about the anterior line of pleura. Now we'll go to the posterior line. In the right side, the siphisternal point. The line extends from the siphisternal point to the C8. It passes the C8, it goes to the C10, then it further goes to the 12th rib. Similarly, in the left side, the posterior part descends from the C6 level, it passes the C8, it passes the C10, then it comes back to the 12th rib. Now the inferior portion. The inferior portion in turns arches back and goes to a point 2 cm away from the 12th thoracic vertebra. I'll repeat it again. The inferior part on the both sides, it in turn goes from the 12th rib to a point which is 2 centimeters away from the 12th thoracic vertebrae. So this is a small glimpse of the pleural line. This is a standard points where we can trace pleura. So these are called as the surface markings of the pleura. Let us see what are the recesses of the pleura. There are certain regions in the pleural cavity which are called as the pleural recesses. Let us see more about it. The space between the parietal and visceral pleura is only a potential space and it is usually filled with a film of serous fluid as we saw. However, in certain areas of pleural reflection onto the diaphragm and the mediastinum, the space between the visceral and the parietal pleura is greatly expanded, and these expanded regions of the pleural cavity are called as pleural recesses. You can refer to the previous figure for a much better understanding. And these pleural recesses serves as reserve space for the pleural cavity for the lungs to expand during deep inspiration. As we know, during this deep inspiration, the lungs need much cavity to expand, and this space is provided by these pleural recesses. Now we have two types of pleural recesses. One is the costodiaphragmatic recesses and the costomediastinal recesses. Costodiaphragmatic recesses is basically the bottom portion which faces the diaphragm, and we have got both the right and left costodiaphragmatic recesses based on the position of the lungs, and the costo-mediastinal recess nearly facing the mediastinum, and we have both the right and left costo-mediastinal recesses. The costodiaphragmatic recess is actually located inferiorly and in between the costal and the diaphragmatic pleura. So the exact measurement when we speak about vertically, nearly it measures about 5 centimeters and lies opposite to the 10th, 8th to 10th ribs along the mid-axillary line. Whereas the costo-mediastinal recess, it is located anteriorly between the costal and the mediastinal pleura and lies between the sternum and costal cartilages. Coming to the nerve supply of the pleura, let's see as both different, the parietal as well as the visceral. First, let us talk about the parietal pleura. The parietal pleura is actually arising from the somatopleuric layer. So this is supplied by the somatic nerves and this is sensitive to pain. When we speak about the costal part and the peripheral part, the costal part and the peripheral part is actually supplied by the intercostal nerves, whereas the inner part, that is the mediastinal part and the central part, is actually supplied by the phrenic nerve. Now the visceral pleura. The visceral pleura that covers the lung arises from the splanchno-pleuric layer, and this is supplied by the autonomic or sympathetic nerves, that is from the T2 to T5, and this part is insensitive to pain. The basic difference between the parietal pleura and the visceral pleura is that the parietal pleura is sensitive to pain, whereas the visceral pleura is insensitive to pain. The blood supply of the visceral pleura, when we talk about, since it is closely associated with lungs, the blood supply of visceral pleura is same as at that of the lungs, that is from the bronchial artery. The branches of bronchial artery also supplies the visceral pleura. Now coming to the parietal pleura. Parietal pleura is supplied by the posterior intercostal and scapular arteries, that is, the same arteries which supplies the chest wall or the thoracic wall will supply the parietal pleura also. Here we have come to the end of basics of anatomy of pleura. This video is specially dedicated to all my medical buddies who are doing really good job despite of all the hardships. Push yourself furthermore harder, and big thumbs up for all your good efforts. Stay motivated. Do not forget to subscribe to Medical Helpline. I'll see you very soon with another video. Till then, bye bye.